Welcome to the new IFord channel. This is the second edition of a series of informational videos sponsored by the IFord Institute. The title is Hot Bunking in Hospitals, the Kiss of Death. IFord Institute is the Institute for Disease Prevention Engineering. The information for this video comes from the text Creating Healthy Hospitals, which is available at iford.org. Hot bunking in healthcare has been the kiss of death for many a poor patient. Hot bunking can be a major cause of disease, and it continues as a standard practice in many hospitals today. Apparently, the patient is not the main concern of hospital management, but profits are. Hot bunking can take place in more than one type of space. The term hot bunking was used in World War II to describe life aboard submarines, where missions could last over 2 months and the submarine could travel over 10,000 miles. Submarines were cramped with very little space available for sleep-in quarters, and where bunks were used by more than one individual. As the bunk occupant awoke and stepped out of the sack, another took his place while the body heat from the first was still present. This is hot bunking. Cleaning and disinfection during these naval missions were logistical nightmares. Today, hot bunking takes place on aircraft. Flights are turned around quickly in order to assure a healthy bottom line. Airliners must be kept flying to pay for their capital costs that could run into the hundreds of millions of dollars. National and international travel can immediately transfer disease from one place to another. This concern is minimally addressed in aircraft operation. With crowded spaces, small seats, and shared breathing air, many passengers can attest to becoming ill after air travel. Was your airplane disinfected prior to your last trip? In hospitals, disease from all previous patients can be passed on to new patients and recirculated throughout the hospital and then carried home by visitors and staff. Hot bunking in hospitals is defined as the limited care and cleaning provided before a patient enters their bed. A patient room may only get new sheets before the new occupant arrives. Not understanding patient requirements leads to failure because of the old 7P adage. Proper prior planning prevents piss poor performance. Piss poor performance is easily defined as 2 million diseases and 250,000 deaths. In many cases, the hospital administrator defines how the patient acquires the disease that they will die of. Because hospital germs are not visible, little care is given to their existence. It is safe to say that throughout the hospital, in all nooks and crannies, there are deadly mutant germs. By not removing these germs, hospitals are guaranteeing that these germs can be passed to patients, staff, and visitors. What does your hospital do? This is the second video recorded for the IFord channel. There will be many more that describe in detail the subject of creating healthy hospitals. The IFord Institute is the only organization dedicated to disease prevention engineering and promoting the healthy hospital design. The professionals in the business have failed miserably. Please become part of our effort to re-engineer the healthcare system.